I think the real benefit of KT tape is missed by a lot of people. People keep using KT tape and think that is useful, and they're struggling with it and they find it not useful, so they stop using it. But I think if they realize this one thing, they might be able to use it and help a lot of their patients. I'll tell you what that is in just 1 second. But what is KT tape, right? You've seen it on pro athletes in NBA, NFL, PJ, MLS, the Olympics for sure. But what is really going on with all this KT tape? What is kinesio tape? How does KT tape work? Who is KT tape for? Is it only for athletes? What if KT tape doesn't work? Is there a brand that is better? There seem to be a lot of different ways people use KT tape. Is there a right way? Is there a wrong way? Yes. What is the best way to use KT tape? I'm going to tell you. Um, First, let's just clear the air on some of the KT tape basics. We need to know what's going on, the fundamentals of what works and what doesn't. Then I'll try to explain what I think is the absolute best way to use KT tape. And I think in any treatment or intervention, it can be beneficial for a wide variety of patients if you kind of understand this fundamental principle about how KT tape works. But first, before we get that little secret out of the way, welcome to the Anatomy of Therapy. I'm Dr. John Cebulski. This week, I'm going solo. I'm going to have to try double hard because Dr. Bobby Riley and his beautiful wife, Jeannie, have had a beautiful baby, Soren Alexander, and we're very excited for them and thankful that everybody is happy. So this one goes out to you, Soren Alexander, and Jeannie, not Bobby. Bobby didn't do anything, but we're excited for him to come back. But getting back into KT taping, I want to talk about how it kind of started off first. And it started off back in the 70s, right, with Dr. Kenzo Kase in Japan. He began kind of researching taping methods, right, that could assist in the healing of traumatized tissues and muscles. He found that standard taping techniques, such as athletic taping, strapping, they called it, provided muscles and joint support. However, they reduced the range of motion, and this reduced range of motion inhibited the actual healing processes of the tissue. So in 1973, Dr. Kase's objective was to create a therapeutic tape and taping technique that could support joints and muscles without restricting range of motion. So that is kind of the big idea, right? This is the fresh and new perspective that KT tape gets. The intervention of KT tape still falls in line with not restricting range of motion. Furthermore, that kind of validates the perspective that one of the major goals of treatment is to, and of course, increase range of motion. Or the proper movement is the idea that proper movement is in fact therapeutic. But the big thing with KT tape is not decreasing range of motion. It doesn't say that KT tape will help you increase range of motion. And we'll kind of get more into this in a second. But that's this fundamental idea that healing actually happens when you do not decrease range of motion is absolutely pivotal. And I believe somehow overlooked by many clinicians. So, you get this with patients all the time. Why does my back hurt? Well, if you think about this principle with KT tape of not decreasing range of motion, oftentimes we've slowly decreased range of motion until the tissue kind of starts to give up. Anyways, so go into this a little bit more. Let's talk about the first kind of question. What is KT tape? Obviously, you've probably seen it like on athletes and stuff. It is a stretchy tape designed not to decrease range of motion and help in the healing process. Sticking closely with the idea that proper healing is indeed therapeutic. Got it, KT tape. Which leads us nicely to our second question. How does KT tape work? So I think this is kind of the crucial point that I'm going to focus mostly on. How does it work? And if we understand how it works, how can we apply that to our patients to help them, basically? Hopefully that kind of fits within our model of treatment. It's not going to be anything crazy. You want everything to fall in line with a goal of getting your patients better. Now, this is where I start to go off script a little more because there are a bunch of different KT tape brands that claim different things about their KT tape. But generally, there are five main physiological effects of kinesio tape. The five main physiological things that it affects are the skin, circulatory and lymph, the fascia, joint, and muscle. Now, they stay safe in wording their their little saying there by saying effects. And I've seen a number of brands promote their KT tape as beneficial to treating the skin and the lymph and the fascia and the muscles and joints. So I'll have to edit my own personal views on this. It's not rock tape. This is not KT tape. This is not Levo tape, but there's a bunch of different brands out there. This is just me. I have a hard time understanding exactly how the tape affects the fascia, the joints and the muscles directly, at least. I mean, yeah, the most obvious one I see that it can treat directly is the skin. And I think that's our way into this, right? There's a lot of stuff that they say where the biggest thing to help promote healing is that it helps the circulation and the lymph. And I have no idea how we could prove this. People always talk about, I feel like I'm really inflamed. And it takes an incredible amount of willpower for me to ask how much inflammation? 10? 100 inflammation? And how will we know that we have less inflammation? I know that like after you take some Advil, yeah, you may feel like you have less inflammation or something because you have less pain. But anyway, it's really hard to track inflammation and circulation. But let's just pretend that we're with one of these Kinesio tape brands. They say that the first step with slapping on the tape, it lifts the skin and it helps with circulation, thereby helping blood, lymph, and the healing, your own healing juices get to your muscles and joints and help in the healing process. I think maybe obliquely, 6 degrees of separation through Kevin Bacon, maybe that happens to the muscles, joints, and fascia. It's very challenging, I think, mostly for your client or your patient to actually be able to experience or sense some sort of change at that deeper level, which is only really building my case as to why and how the superficial approach to thinking about the skin as you tape is actually the most efficient way to tape. Because your patients are really going to feel the skin, and I'll kind of walk through this with you. But so yeah, at a certain phase, yes, the tape does support through a certain joint in a certain direction, and will not decrease range of motion. But if you're going to go with a little bit of that tape in the support range, it will stop you from going through painful patterns. And I'll kind of list a bunch of these kind of painful patterns and how to go after that at the very end here, which is not far away. But yes, it can stop painful patterns, but I don't know that it necessarily supports a joint. So let's imagine you've got your shoulder is hurting at the AC joint, and specifically it hurts with lateral abduction of the arm, right? So you lift your arm up out to the side, ow, it hurts on the top. So what I'm suggesting is that you place the tape with minimal tension over the lateral aspect of the deltoid and the shoulder while the arm is in an adducted position. So if you pull your body across, now you've kind of created some tension on the outside. You lay that tape down while the arm is adducted. So it will place a different amount of tension and kind of trap the tension of that shoulder there. To limit the overuse of that specific movement of lateral abduction. So maybe you play in a sport and every time you laterally abduct your arm, it hurts you. So this is the idea here, is that you need to stop picking the scabs and allow yourself to heal. That's just kind of obvious. So don't do the thing that hurts. The tape will be there for you if you can't really remember to do that. And there are some good postural ones as well that we can kind of talk about. But I'd really rather restrict the taping probably to a single joint and a single movement. It's going to be hard to get multiples in there, basically. So although this can have an effect on the muscles and joints, and the intervention is really directed to taping the skin over said muscles and the joint with the opposing tension. Here, adduction is helpful while abduction is painful. So, right. So if you find the painful one, you want to tape the opposite, right? This is a standard approach. However, let's think about the same situation. You can actually achieve some pretty interesting outcomes if you move the affected joint passively into or even past the point of pain and tape in that position. So if I'm pain in the shoulders and lateral abduction, and I tape in an adduction, that's the kind of common way to go about it. However, if you take that joint into, let's say, passive abduction up and away into the painful movement, but passively, so that the skin is kind of on slack on the lateral shoulder, and then lay down the tape. Now that those muscles in that lateral motion are in fact slack. I think this is the most clinically consistent way I've been able to use KT tape and to help my patients. Otherwise, it's simply that I slap some tape down, make it look nice and kind of wavy, maybe mix up the colors, and the patient tells me, and just pray that the patient tells me it feels good. Using a solid skin stretch or taking the tension off of the skin and then taping is the best way to allow my patients to actually sense what I'm trying to accomplish with the tape. So I think if you're laying down the tape, you either need to put a lot of tension on the skin, specifically through the opposite direction of the pain, or take off the slack of that position. So like the abducted and adducted position we're kind of talking about. Because once you put that tape down and the skin tension is really changed, your patients will really be able to kind of feel it. I suggest you kind of try it. I'll do it with patients sometimes with just wrist flexion and wrist extension. You can just kind of get a small piece of tape, put the wrist down and all the way into flexion, put some tape over the, let's just say the dorsal side of the wrist, the back of the palm, right? And then tape it in extension, and then put them tape down and see how that affects the joint's range of motion. And really taping it in one of those extremes is really the only way that I found that KT tape is actually good. This is another good one. To answer the next question, who is KT tape actually for? The main problem here is that it's mostly seen on high-level athletes, and your average Joe doesn't think they can find any benefit in the taping. This is untrue. One of the most obvious differences between pro athletes and us mere mortals is that they are far more conditioned than we are. That said, the more deconditioned the patient, the more effective the passive intervention will be to their system, right? So while the athlete might be attuned to understanding what's going on in their body, if your patient is really deconditioned and you make a semi-good intervention, it will affect their system far more than the athlete. You're going to have a more direct and specific intervention if you're going to do a professional athlete. Basically, that said, the tape will not heal you. Within the context of treatment, you need to explain, especially to that deconditioned patient, it's wildly important to explain that where the KT tape falls in terms of intervention and returning your patient to their normal ADLs. So listen, this tape will not heal you. What I'm trying to do is restrict a damaging movement pattern that you have, or I'm trying to encourage a positive movement pattern that we want to adapt into and make it part of our system. But the tape will not heal you. Within the context of treatment, it is merely stopping you from reverting to your old movement patterns. And this is just another way of describing the first issue I talked about, skin tension or slack, to limit or encourage certain movement patterns, and redundant. The tape is not the treatment. It is one piece of the puzzle. A good clinician can discover a seemingly unlimited number of ways to tape when considering what the proactive movement might be. So it's good. Here's a couple of good examples. So to say what I'm talking about, to limit lumbar flexion, you tape them in lumbar extension. So think of Superman. So they extend their back a bunch in a hopefully passive and kind of nice, non-painful way. You slap the tape down, and as they go into flexion, that tape begins to pull on them. They begin to sense that they should not continue to flex, although it will allow them to flex somewhat. They're allowed to flex. Let's go through another one. To encourage hip extension. So that first one, we were limiting lumbar flexion. Let's do the opposite. To encourage hip extension, something we like on this show. Obviously, we love hip extension. If you want to encourage hip extension, you place the tape on them while they are in hip extension, so that once they go out of hip extension, they start to flex their hip. They'll then start to feel that tension on the tape, right? Here we go back to a limiting one. If you want to limit, so let me go back to the encouraging one real quick. If you encourage hip extension, let's just say you put their leg, their femur into extension, like a quad stretch situation. They're prone on the table, and you put some tape on their hamstring while their hamstring is in extension. Their femur is in extension. When their leg goes into flexion, they're bringing their knee up or they're beginning to sit, they're going to feel that tension more. In other words, they will get relief from that tension if they move their hip back fully into extension. So anytime they go into flexion, they're going to get a little bit of resistance from that tape, and they're going to remind them, hey, we want this back into extension. So it's just giving that patient a reference, making their system aware. And again, it's making the skin aware. It's not really making bones, joints. I guess the fascia is picking it up, but I'm really only talking to patients about the skin, to be honest. Okay, let's go back to limiting. If you want to limit cervical flexion, you tape in cervical and thoracic extension. So again, I'll say that again. If you want to limit cervical flexion, let's just say you have a patient who, I don't know, is looking down at their phone, right? And if they continue to flex their neck down, they're getting problems. So what we do is have them extend backwards. Again, like we were talking about with the lumbar, place that tape down. I like to kind of tape at the CT junction. I don't like to go too far into the neck because I want to let the neck breathe, especially below C4, C5, super mobile through that area. So I'll tape the lower cervical spine in almost extreme extension, such that when they go towards flexion, they begin to feel that tape start to give them some resistance posteriorly. So it kind of encourages that shifting backwards and extension. Let's go to one more encouraging one. If we want to encourage thoracic extension, again, let's go back to someone's on their phone, they're hunched forward, right? You would tape in thoracic extension so that when they go to thoracic flexion, they begin to feel that tension. It's a pretty simple concept kind of once you get it. But then you can start thinking past multiple joints. If you want to think about thoracic extension or you start to get in thoracic rotation. I've got another example with the neck here. But it's far less about the direction of the tape, the color of the tape, where the anchor is and how much tension is between the two anchors, than it is what's happening and what the tape is being used on and for what purpose. If you can kind of figure out the purpose, I'm not saying it's a Simon Sinek start with why, but it is, then you have a way better way to go about the tape. And they realize that the tape is not the savior. It's just part of a well-balanced treatment plan that I know you're creating for all your patients. But my basic rule will be to overset the posture you'd like to encourage. So we need thoracic extension. We go overset the posture into thoracic extension. Really exaggerate shoulder external rotation before laying the tape down. If you combine movements, this is where I was getting to, like let's say left shoulder external rotation, left forearm supination, wrist extension, and so on, you can create more torque to trap underneath the tape. It's not necessarily an inertia, but you can essentially get a whole sling of muscles and create some tension there, such that when they try to unwind that tension, you've kind of built into the system some opposition. There are a number of other fun techniques to use with the Ktape, but the last one I want to talk about is in reference to when a patient has a very localized trigger point or area of pain. Now, we're treating soft tissues, so trigger points, you can talk about knots. If you want to look at Janet Travell's work, it's awesome stuff. And some people aren't crazy about trigger points, but there are patients who will say, I have pain, and they'll put one finger exactly where it is. That's kind of what I'm referring to. So let's use the common upper trap levator trigger point, or knot, that patients often describe. If, say, this trigger point is triggered by cervical rotation away from the side of pain. So let's say the pain is in the upper right trap, right? And when they look to the left, that triggers that point, right? So what we want to do is have them turn all the way to the right. So triggering turn to the left, we'll have them turn all the way to the right, taking off all of the slack off of that triggered point, so that and then here's the one trick with taping this. You don't tape on the triggered point. You tape below and or next to that triggered point while they are in a slacked position. Because what happens is When they turn to the left and that point is triggered, let's say, that is a point of tension. And if you take off the slack, lay down the tape, you create a new point of tension, whereby when they turn, they'll start to feel that tape, and then that trigger point is essentially getting stretched every single time. Now, a lot of times if that trigger point is, the bell is rung, let's say, it won't give them relief then. But again, this goes back to limiting painful movements, limiting poor movement patterns, not allowing you to pick the scab and trying to get you to heal. That's the main point with the KT tape, as with the rest of therapeutic interventions, creating situations where tension is either relieved or tension is created naturally by the patient. That's the definition of exercise or rehab, really. You're creating tension in different areas in a controlled way than, let's say, the pain is causing tension. That's the definition of exercise. KT tape may be frowned upon by those who use it or see it as something besides that. But if you do realize where you need to create tension with your patients and where it's best to relieve tension, then the KT tape can be a major ally in helping your patients. Thank y'all for listening this week. I really appreciate it. Please share this podcast, like, subscribe, leave us a review. I really appreciate y'all listening. And again, thank you to a big welcome and congratulations to the Rileys. Welcome to the world, Soren Alexander. Peace.